Hi, I'm Dr. V. I'm an interventional pain specialist and chief of the spine pain program at Bloor Pain Specialists in Toronto. But today, I'm going to be answering some common questions about low back pain and sciatica.
How can you treat SI joint pain, Facet joint pain, Cluneal Neuralgia, or Piriformis syndrome?
So there are two ways that we can treat joint pain through intervention. One, we can put a needle into the joint itself, and we can inject something into the joint. That needle inside the joint can be used to deliver anything we need. It can be used to diagnose, it can be used to treat. We can use a needle to direct it beside the joint, on top of the bone, in a little groove where a little nerve branch comes in to feel the joint. And we can heat up that little nerve branch with radio frequency energy to cause that little branch to break down, to lose feeling to the arthritic joint, so people don't have to feel their arthritis. They don't have to feel the radiating pain of their arthritis. Because this pain can be just low back, and in some cases it can be low back radiating through the glutes or further down. After all, the big roots are right beside the joints. And when it comes to the SI joint, those big roots have passage immediately beside the joint. Their branches can be heated along the bone to disrupt the signal coming from the painful joint inwards, so people don't know that they have arthritis. Fine, the branches grow back. It takes about 6 months in many people. If the metabolism's a little bit slower, people get 9 months, a year, in some cases longer. But ultimately, there are two ways to treat: inside the joint, or treat the feeling to the joint, the wiring, the nerve endings, the branches that connect to the joint. Because ultimately, we don't have to feel the pain through those branches. We don't have to feel the signal coming through from an arthritic joint. We don't have to know that we have arthritis. So the piriformis muscle attaches to the sacrum here and crosses over like this, going towards the hip bone. This crosses the sciatic nerve that comes out of here. And the piriformis muscle, if it shortens, if it flattens, it can be dilated. We can use an ultrasound machine to see the soft tissue layers, put a needle into the piriformis, and balloon it open with saline or any other liquid. Most of the time we use a combination of saline and local anesthesia. We don't have to use local anesthesia, but we like people. So why not freeze? We freeze, and that stretches. The saline stretches. All we're doing is a massage that's inverted. What do you do when you have a knot in the shoulder area? You get a massage, you stretch it out, and from external pressure, pushing, the fibers break apart. We're here, we put a needle within and stretch from within. Balloon the fibers open. Balloon the fibers open. Release the pressure. Let the muscle stretch. As it gets longer, it stops pushing the sciatic nerve. Easy enough fix. Up here, along the iliac crest, there's a muscle called the quadratus lumborum that connects. Another muscle from above comes in, the latissimus dorsi, and connecting with the thoracolumbar fascia creates a small canal on the iliac crest, on the top of the pelvic bone. Through that canal, the cluneal nerve passes, the superior branch. And that branch goes down over the glutes. So there are a number of treatments there. We can release the tension in the fascia and the muscle. We can go after the nerve itself, put an anti-inflammatory there. Or we can heat up the nerve with radio frequency energy to break down the nerve so you don't have feeling through that painful area. If you have a question that you'd like us to answer in a future video, leave a comment below. And please remember to like and subscribe.